Hello, this is Dr. Jason Acevedo here today to talk to you about ear tubes. Very common, very safe procedure, usually performed for children, but occasionally for adults. If you're watching this video, it's probably because you or your loved one is about to have ear tubes performed. And like I said, this is a very safe, very common procedure, and this is just a short video that will go through what to expect. So before the procedure, you or your loved one will be required not to eat or drink anything after midnight the night before surgery. And that's something the surgery center or the hospital will call and go over with you. But what will happen is you'll show up. Either you or your child will get essentially a laughing gas to get them asleep. Typically, it doesn't require an IV or a breathing tube, anything complex like that. And then once you or your child is asleep, what I do is I use a microscope, clean the ears out really well, make a small incision in the eardrum. And then I place a tiny plastic tube in the eardrum, which allows the ear to ventilate. I'll vacuum out any fluid or infection that might be behind the eardrum. And it's not uncommon to see some drainage after the procedure, sometimes bloody, sometimes mucousy, sometimes almost the consistency of an infection, but that's a good thing. That's the stuff that needs to come out of you or your child's ear. After the tube goes in, I do put in an antibiotic eardrop, and then we'll send you home with those same eardrops to use for the next 3 days. And very simple prescription, just 3 drops 3 times a day for the next 3 days. And that helps to prevent infection after the ear tube, as well as maintaining the patency of the tube. After those 3 days, I'll want you to hang on to those eardrops, because once the tube is in the ear, anytime there's a problem with the ear, blockage, inflammation, infection, there typically is not pain, there's typically not fever, you would just see drainage from the ear. Well, all you need to do is restart those eardrops, same way, 3 drops 3 times a day for the next 3 days. And if that infection doesn't clear up pretty quickly, call the office and let me know so we can take a look. That being said, the procedure is very fast, typically 5 to 10 minutes, and then afterwards anywhere from 15 to 30 minutes in recovery. But after the procedure, you or your child can go home, resume normal activities later that day. You wouldn't want to drive for 24 hours, or if it's your child, you wouldn't want them to go back to school that day. But if your child's in school or daycare, they're fine to go back the next day. And as far as taking care of the tubes, really not a lot required. The biggest thing we always mention is being cautious with untreated water. Showering, bathing is fine. Earplugs are not required for those situations. Or chlorinated pools, saltwater pools, earplugs not required. Now, if your child or you, if you're the patient, were to get in a lake, ocean, rivers, any kind of untreated water, then you would want to wear an earplug. And that just prevents that unclean water from getting through the tubes and causing an infection. And earplugs can be purchased at most pharmacies or online at Max, MACK''S online, or Amazon.com. There's even custom earplugs you can purchase, or a device called the Ear Bandit that's made by Max, that's essentially a headband that covers the ears. Some kids really dislike having anything inside their ears, so if that's your child, those ear bandits can be really helpful. After your child or you is discharged, I or my nurse practitioner will see you back, usually at about 2 weeks, just for a quick checkup to make sure the tubes are patent, working appropriately. If the hearing testing was abnormal prior to the procedure, we may want to repeat that to make sure it's addressed the problem. And then typically every 6 months after that, until we know the tubes have fallen out, which they typically do anywhere from 6 to 12 months after the procedure. They don't require removal, they just fall out on their own. And when it comes to complications from ear tubes, they're essentially very rare, less than 1%. The biggest complications we would mention would be drainage from the ear, which, like I mentioned, is not a bad thing. It means the tubes are working. Occasionally, when the tube falls out, it can leave a hole in the eardrum called a tympanic membrane perforation. And if that hole was not to heal, occasionally it does require a surgery to fix it. And then third, once in a great while, we'll see a patient with a tube that doesn't fall out in the normal time frame. It goes beyond a year, 18 months, 2 years. That is not a big problem. If that tube were to stay in 3 to 4 years, occasionally it does require a secondary procedure to remove the tube and patch the eardrum. But fortunately, that's less than a 1% chance. So hopefully that's answered your questions, and looking forward to taking care of you.